Addiction is a developmental disease. It typically begins in childhood or adolescence. In the past, addiction used to refer just to psychoactive substances that cross the blood-brain barrier, temporarily altering the chemical balance of the brain. This would include alcohol, tobacco, and some drugs. A considerable number of psychologists and other healthcare professionals now insist that psychological dependency, as may be the case with gambling, sex, internet, work, exercise, etc., should be counted as addictions because they can lead to feelings of guilt, shame, hopelessness, despair, failure, rejections, anxiety, and/or humiliation. Drug addiction is defined as a chronic, relapsing brain disease that is characterized by compulsive drug seeking and use, despite harmful consequences. It is considered a brain disease because drugs change the brain, the structure, and how it works. It can be long-lasting and can lead to the harmful behaviors seen in people who abuse drugs. When a person is addicted to something, they cannot control how they use it, and they become dependent on it just to cope with daily life. Some people might think that it is just a habit, but a habit eventually develops into an addiction. What's the difference? With addiction, there's psychological and/or physical components. The person is unable to control the addiction without help. A habit is done by choice. Put simply, with a habit, you are in control of your choice. With an addiction, you are not in control of your choices. No matter how often or little you're consuming, if your drug is causing problems in any area of your life, you likely have a drug abuse or addiction problem. Some people are able to use recreational or prescription drugs without ever experiencing negative consequences or addiction. Why do some people become addicted and others don't? Well, just like other diseases, addiction differs from person to person. Genes, mental health, family, and social environment all play a huge role in addiction. Some risk factors that increase your vulnerability include family history of addiction, abuse or neglect or other traumatic experiences in childhood, mental disorders such as depression and anxiety, early use of drugs, and smoking or injecting a drug can increase this addictive potential. People take and use drugs for many reasons. Reasons such as to feel good. Most abused drugs produce intense feelings of pleasure. The initial sensation of euphoria is followed by other effects, which differ with the type of drug the person is using. For example, the high that comes from cocaine are feelings of power, self-confidence, and increased energy. People also use drugs to feel better. People who suffer from social anxiety, stress-related disorders, and depression begin using drugs in an attempt to lessen feelings of distress. Drugs are also used to do better. The increasing pressure that some feel to chemically enhance or improve their athletic or cognitive performance can play a role in initial experimentation and continued drug abuse. Another big reason is curiosity and because other people are doing it. Adolescents are very vulnerable because of the strong influence of peer pressure to use drugs. If taking drugs makes people feel and do better, what's the problem? Well, there's many bad things that can happen when a person starts taking drugs. At first, people may perceive what seems to be positive effects with drug use, and they may also believe that they are in control of their use. However, drugs can quickly take over their lives. Over time, if the drug use continues, pleasurable activities become less pleasurable, and the use becomes necessary for them to simply feel normal. They reach a point where they seek and take drugs no matter the problems they cause in themselves and their loved ones. They start to live their life around finding and using the drug. Some may start to feel the need to take high and/or more frequent doses to get the high that they used to get because they can build such a tolerance to it. Common signs and symptoms of drug addiction is that they have built up a drug tolerance. You need to use more to get any effect. They take drugs to avoid or relieve withdrawal symptoms such as nausea, restlessness, insomnia, depression, swearing, shaking, and anxiety. They've lost control over their drug use. Their life revolves around the drug. They've abandoned activities they used to enjoy. They continue using, despite knowing it's hurting them. If a loved one or someone you know has a problem, speak up. But take care of yourself and don't get caught up in their problems that you neglect your own needs. Do not attempt to punish, threaten, or bribe the user. Don't cover up or make excuses for them. And don't take over their responsibilities. Doesn't help anything. The good news is that with the right treatment and support, they can counteract the disruptive effects of drug use, and regain control of their life. The first obstacle is to recognize and admit they have a problem, or listen to loved ones who are often better able to see the negative effects drug use is having on their life. Working at the hospital, I have seen many cases of drug overdoses and people having to go through withdrawals. It is a horrible, sad, painful thing to watch. The sooner the drug user stops and gets help, the better.